Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Brumell.
Good afternoon, and thank you for joining us this Saturday on American Medicine Today. I'm Kimberly Brumell, joined by executive producer of AM Tampa Bay, Ethan Euchre.
Good afternoon, everyone.
Good afternoon. And to my right, I have Jeff Wagstaff sitting next to me. He is our co-host of American Medicine Today. Thank you for being here.
Howdy, howdy, howdy. Thanks for having me.
And, of course, we have world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute. Thank you for joining us.
Hello, hello.
Everybody's excited today. I love it. Jeff just got over H1N1. He was near death's door for like a week and a half, and now he's excited to be back.
So I would like to warn the audience, if I'm a little overbearing or slightly annoying today, I have like an entire month's worth of orneriness stored up.
That's no excuse. We'll just have Kimberly slap you if you get out of control.
Whoa, family show.
Well, we wanted to get into a little bit about some statistics. So we're always talking about how wonderful the Bonati spine procedures are. Well, that is true, but we've found out that the number one reason that a lot of open back surgeries are not effective and that some patients have continued pain after surgery is because the area that was operated on wasn't the true cause of the patient's pain. And in addition, we're finding out that the infection rate for open back surgery is at 4.5%, and immediate complications for traditional open back surgery is at 31%. Now, staggeringly, there's a 41% increase in the use of painkillers, particularly opiates. And for those that have undergone open back surgery, we've said before, and we're going to state it again, the statistics for single-level fusions have a failure rate of over 60%. And 3-level fusions have a failure rate of over 85%. Those are just staggering statistics to me, and I'm sure everyone else listening.
Indeed.
Now, the sources we got those from are the Division of Epidemiology and Biostatistics, the Department of Environmental Health, and Health Insights Today, the Scoliosis Research Society. So it's not just us making those statements. Those are valid statistics. Now, Dr. Bonati advanced medicine and changed medical history forever, and he is the genius behind the exclusive Bonati spine procedures, the most effective and only true alternative to open back surgery on the market today. Alfredo Bonati, MD, single-handedly invented, patented, and perfected the field of what's known today as minimally invasive laser spine surgery. And the successful procedures that we are referring to are the Bonati spine procedures, and they are exclusive to the Bonati Spine Institute. Without his contribution to medicine, there would be no alternative today to those highly invasive open spine surgeries. And over 40% of the patients seen at the Bonati Spine Institute have suffered from previous failed back surgeries at other facilities. That considered, our patient-reported success rate is over 98%. So Bonati succeeds where others have failed. Don't just take my word for it. We have patient Dr. Dean Spitzer on the line, who received treatment at the Bonati Spine Institute in 2008. He's going to tell you firsthand how those patented Bonati spine procedures helped him get back to life.
Let me clear something really, really important. You just said something, Kimberly, that is extremely important. Mm-hmm. The comparison that you did between infections and results is staggering to see that we don't have infections after 45,000 procedures. Mm-hmm. When you say we don't have infections, people will never believe that. But you need to understand that the procedures require that we go through a tube, and the tube is constantly irrigating with fluid. Mm-hmm. That fluid has antibiotics. So the possibilities to get an infection with a small incision and constant irrigation is almost very, very seldom will happen. Mm-hmm. For example, when you do arthroscopic procedures of the knee, 1% is the sort of infection. But the knee is more exposed. When we do the spine, the exposure is very, very small. So the result of a possibility to get an infection is almost zero.
How big is the typical incision, Dr. Bonati?
It goes around, depending on what procedure we're going to do, but if we do the biggest type of a exploration in the area, it's around maybe 16 millimeters, the maximum radium that those tubes will have.
I'm not European. I don't know millimeters.
What's that, the size of
I
a
don't know
quarter,
metrics.
maybe? About
Yeah.
a quarter?
Is
A dime?
Small, it's like the size of a dime.
Wow.
Yeah,
That's
size of a
incredible.
dime. And maybe the dime is even a little bit bigger, but that's the size.
Wow.
And then you go 6 inches down, and when you do that, and you're irrigating constantly, all these tissues are constantly floating in fluid with antibiotics. Some possibilities of infections, almost none.
So where does all that fluid go, though, that you're pumping in? Is it sucked back out?
You're using another system that is sucking all the fluid out.
Interesting.
The fluid will allow to clean the scope, so it's constant correct visualization there.
You know, Dr. Bonati, every week we talk about the failure rate of traditional back surgeries. But one thing that when we all started the show and I started researching and educating myself on traditional open back surgery, the part that I found so amazing was when they open a patient, they have to move the organs away to open that area up for the surgeon. We saw in the videos that you showed me where sometimes those organs are set on a tray or set aside. I would think the recovery from not so much the spine surgery, but from the incision and all of
Just the disruptive nature of having
Yes.
all of your organs moved
yeah, to have all
around.
your organs removed and then put back in place, I would think that recovery time would be months.
But it's not just that. It's the tearing of the tendons and the muscles, and that the repair on that takes a long time, Dr. Bonati, correct?
Yeah, but you guys are exaggerating a little bit. The incision on the back is around 6 inches, and the source why you can have an infection is because you have a couple of surgeons, a couple of assistants, you have a 6 inches opening, and the people inside the operating room, even if it is with all the special air to maintain the area clean, the whole thing, you always have contamination, and the contamination later on can be a problem. 6 inches is difficult also to be treated. So when the nurses that they're in the hospital, they are moving from one patient to another one, sometimes hygiene is not done properly. And then an infection on this type of a population of patients with open surgery is devastating, is really, really bad. Now, you Jeff, you're talking about moving organs and the thing. Well, that is when the patient's been operated with a type of a fusion with an anterior approach and a posterior approach. That is extremely, extremely aggressive surgery. It's being done. And I think it's totally unnecessary. We have patients that they have this type of a procedure done. They come to us. We corrected that problem, and we found that the patient didn't need that type of surgery. And the things that they were done are even worse for obtain better results. Now, the first thing that we need to do is take the screws, take the plates, the whole thing, and have the area enough clean for us to start to correct the problems. But as I said, the failure, the possibilities of infection is because of the large amount of hours of exposure, a lot of people in the operating room, and large surgery.
We'll get to more on that in just a minute, because not only the infection but also the invasive nature of those, I think, is what Jeff was referring to as far as some organs and stuff being taken out. Because we've talked to those previous patients who had been told, had they gone through those procedures, they'd have been sliced open in the front, sliced open in the back, and there's no direct path to the spine, I don't believe, from the front. We'll get to that in a minute, though, Dr. Bonati. But first, we'd like to head over to Dr. Dean Spitzer. He's on the line. He's a patient of the Bonati Spine Institute, had surgery in 2008. Thank you for joining us on American Medicine Today.
My pleasure, Kimberly. Thank you. And one of the reasons why I'm so glad to join you is because I get to thank Dr. Bonati personally for all he's done for me.
Thanks.
Thank you so much, Dr. Bonati.
Thank you, doctor.
Well, we want to get into how the whole procedure changed your life, Dean, really from the beginning. We're kind of coming up against a break. There is a couple of minutes left, though. So why don't you take us back to where you started, when in your life you started to feel pain, why, the causes, and just kind of paint the picture from there. And then once we get up to that point, we'll take a quick break and we'll hear about your experience at Bonati Spine Procedure. But
Sure.
Take us back to the beginning.
Yes, well, I'm an inveterate runner and walker. I've probably walked over several million miles in my life. And I didn't realize it, but I had bad posture. And it's sort of like the alignment of your tires, your wheels. You know, it can do a lot of damage. So being out of alignment for all my life and putting so many miles on my body just did a lot of damage. And after a while, I was in so much pain, especially with the sciatic nerve, I couldn't walk. I was on crutches. It was just horrible. And I knew I had to do something, and I didn't want open back surgery. And so I heard about the non-invasive surgery, and I did my research on the internet. And initially, I went to Laser Spine Institute because it was near us in Tampa, and I had not heard of the Bonati Institute, and they didn't do much of anything. So I continued my research, found Dr. Bonati and the Bonati Institute, and I am totally pain-free and
Spoiler alert.
Continuing to walk and run and just have a great life.
See, Dr. Spitzer, you just gave it all away. You just ruined the whole story. You jumped to the conclusion. Come on now.
But that's okay. You know, I'm a public speaker, so it's important to have the beginning and the end, and then fill in the middle.
Exactly, and we're going to do that in the next segment. And I want you to walk us through the entire, the whole, rigmarole
Shebang.
of what you went through, because it's still very interesting to me as a layperson of what you guys go through. So I'm going to put you on hold here, Dr. Spitzer. We'll get back with you in just a second. Kimberly, if people want to get in touch with the Bonati Spine Institute, how do they do so?
Well, they can give us a call at 855-267-0482, or they can visit us on the website at Bonati.com. If you're local, head out to Hudson Avenue and US 19. We'll hear more from Dr. Dean Spitzer on the flip side of the break. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. The Bonati Spine Institute is proud to announce more than a 90% success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit our website at Bonati.com.
All my pain is gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible.
It gave me my life back.
It's just wonderful.
I feel fantastic. It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thank you for tuning in to American Medicine Today, brought to you by the Bonati Spine Institute. I'm Kimberly Brumell, joined by world-renowned orthopedic surgeon Dr. Alfred Bonati of the Bonati Spine Institute, Ethan Euchre, and Jeff Wagstaff. Now, before the break, we were hearing from Dr. Dean Spitzer, and he was telling us his incredible story about how he suffered in pain for quite some time, and he had lumbar surgery back in 2008. He was starting to tell us that he's really good now, but we kind of want him to fill in the blanks. Tell us how that process happened. And he did mention having a prior surgery somewhere else wasn't successful, and that's why he sought out the Bonati Spine Institute. So, Dean, why don't you take it away?
Okay. Yeah, so I found the Bonati Institute on the Internet, and I liked what was said about it. And so we went and visited, and we were treated fantastically well. We scheduled some surgery, and I was particularly impressed with what I call the Bonati experience. I think I was the first to coin that expression because
you're not going to get any
from
royalties.
The moment that we entered the building, we were treated like family. It was absolutely wonderful, So I actually had 5 surgeries because of my problems being at multiple levels and multiple sides of the spine. And my wife and I would drive back and forth between Lakeland, where we were living, and Hudson. And whenever we got to the Bonati Institute, we felt like we were home. It felt weird after the problem was solved, not going back to visit. But it was just a wonder. Everybody was so professional. And after each surgery, it was incredible. Within an hour or so, I was able to get up and walk around. There was no pain. But, of course, because there was a major problem, I had to, come back on multiple occasions. But every time that I had the surgery, things got progressively better. But then, as Dr. Bonati explained, when a problem gets solved, a big problem gets solved, another problem might emerge that was masked by the pain of the bigger problem.
Yes.
And but as soon as all the problems were solved, I was pretty much pain-free, and then all I had to do was some physical therapy, continuing to strengthen my abdominal and back muscles, and now I am just as active and limber and fit as I was 20 or 30 years ago. But this time, I'm using good posture.
Good.
That's
good.
important.
Now, Jeff, I think you have a question.
Well, I was kind of curious. Tell us about when you were actually at the Bonati Institute and you went through the procedure. Although you were sedated, you're awake, you're alert, you're aware. Tell us how that procedure went and how it alleviated your problems and how you were able to communicate with Dr. Bonati or the surgeon.
Yeah, that's one of the amazing things about this minimally invasive back surgery is, although you're sedated and there's no pain through the process, when the surgeons are doing something, they're constantly communicating with you and asking for your feedback because it's very pain is very difficult to see. So it depends on the patient's involvement in the process. And I, being a psychologist, enjoyed being involved in the process. To me, the whole psychological environment was very positive. and I felt no fear. I was very well prepared for each of the surgeries. I had complete confidence in everybody who was on my case, and of course I was honored enough to have Dr. Bonati as my surgeon. So I just was extremely confident in the competence of everybody involved. Everybody from the anesthesiologist, I remember him well, Dr. Hirschheiser, and everybody else in the process was just so kind, thoughtful. Just everything is patient-centered.
Now, Dr. Spitzer, go ahead and tell us how you are today. I mean, have you continued to be pain-free? This was, 6 years ago?
6 years. Mm-hmm.
Yeah. I think the healing process probably took about a year. I was pain-free from a standpoint of continual pain, but obviously over the years my back and abdominal muscles had atrophied, or certainly not developed. And so, it took a while before I could really engage in the kind of strenuous exercise that I can now. But absolutely, as far as normal everyday activities are concerned, I was pain-free almost immediately after that final surgery.
Now, we were just talking about the anesthesia and how being part of that interaction with the doctor is what makes the Bonati spine procedures so successful. I think you're aware, and I don't know, probably our listening audience may be aware that other facilities put people under general anesthesia. That is something that we don't do because we don't like keeping people in the dark. We want that constant interaction to make sure that we're able to pinpoint the root of the problem. So,
yeah, I think I had mentioned that my first surgery was at Laser Spine Institute, and they also advertise that they do keep the patient sedated and not under general anesthetic, but my experience was I did not remember anything during the surgery. So for some reason or another, I was knocked out. And that wasn't my experience at the Bonati Institute. I was always sedated, but very aware of what was going on and able throughout all the surgeries to communicate with the surgeon and the anesthesiologist.
Well, Dr. Spitzer, we are so glad to hear that you are currently living pain-free and experiencing a life without the limitations that you had in the past.
I think you had mentioned hiking, so good luck on those further treks. I think you even said you were doing better than your wife.
Uh-oh.
Oh, yes.
Don't say that.
I actually now am able to be back hiking 20 or 30 miles a day.
Amazing.
That's fantastic.
Even uphill.
All right, Doctor.
Up mountains.
Oh,
look at that. We'll keep climbing those mountains, Dr. Spitzer. We appreciate you joining us on American Medicine today,
thank
sir.
you.
Thank you.
Thanks again, Dr. Bonati.
Thank you, Dean.
All right, another success story. So, Kimberly, in closing, as we are up against the break, how do people get in touch?
Well, they can reach out at 855-267-0482 or visit Bonati.com. We'll have more from a couple doctors that are going to be joining us. Ethan?
Yeah, very quickly. It's pretty interesting. February is American Heart Month, and Carl and Joan Robinson are a couple of health educators. They're going to tell you what kind of foods, spices, and herbs that you probably have right at home can help you build a healthier heart.
Ooh, I'm going to have to check my cabinets.
There you go.
We'll hear more after the break. You're listening to News Radio 970 WFLA. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. The Bonati Spine Institute is proud to announce more than a 90% success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit our website at Bonati.com.
All my pain is gone. Gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful.
I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Bermel.
You are listening to American Medicine Today. I'm your host, Kimberly Bermel, joined by world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute, Ethan Euchre, and our senior fellow.
He thinks he's a senior
co-host.
I just think it sounds very cool.
I don't even know what that means anymore.
No. Earlier, we were speaking with a former patient of the Bonati Spine Institute. You heard his miraculous recovery and his journey back to life. Amazing things happen with those patented Bonati Spine procedures. But Ethan, we have a couple doctors on the line. Dr. Carl and Joan Robinson.
Yeah, the show is American Medicine Today, and obviously we focus on Dr. Bonati and how amazing he is with his spinal surgery and techniques that help people that are living in pain. But we also kind of broaden out occasionally and talk about things just in the medical field and health in general. And this kind of caught my eye. Carl and Joan Robinson, they're a couple of health educators, experts in sort of supplements and things like that that can help strengthen your heart. February is American Heart Month, if you weren't aware. And we're talking all about foods, spices, and herbs that help build a healthier heart. Carl and Joan, welcome to the show. How are you?
We're doing great.
Excellent. Wanted to start out by saying I'm looking at your list here of a lot of these things are items that most people have in their cabinets. One of them is garlic. Now, are we talking about granulated garlic or raw garlic? I love raw garlic, and it says here that it helps reduce cholesterol, protects the heart and the circulatory system. My wife, not a big fan, especially after I eat it. But how is garlic good for you?
Well, first of all, it is the raw garlic that you want to deal with. Usually the granulated dried garlic has lost a lot of its potency, in some products up to 90%, because it oxidizes. And it's it's very fast. But one of the ways of preparing raw garlic is you do crush it, you let it sit for 10 minutes because it activates the allicin. Then you use it. In cooking, it's a little slower, that breakdown, and you get the benefit. But it is the raw garlic. And may I add that during World War I, when they ran out of sulfa drugs on the battlefield because antibiotics had not been invented yet, the corpsmen referred to using garlic, crushed garlic. They pack it right into the wounds, and they saved many limbs, alleviated a lot of gangrene, and saved many lives. And garlic is a storied herb as far as its use in the later days of World War I.
That's absolutely incredible. Like I said, my wife is Italian, so I eat a ton of that stuff. So hopefully it's keeping the old ticker healthy. Something that Kimberly might like, and it's probably good news for ladies everywhere. It says here, dark chocolate.
My favorite.
Good for you?
Absolutely. A few years ago, there were studies that came out saying dark chocolate is good for your heart and circulatory tonic, and people need to know that this is not milk chocolate, or chocolate milk. We're talking about dark chocolate. You know, when you see the bars that say 60% dark chocolate, like that, it's very good for your health.
And also, it has the additional benefit for women of being a natural mood lifter.
Ooh. Well, I think I need to go find more.
I need some for my moody wife. Absolutely.
Now, there are some chocolates, because I see here you talk about cayenne pepper also being something that helps improve elasticity of blood vessels and has increased benefits of blood pressure. They mixed, actually, dark chocolate with the pepper. And I have to say,
excellent.
It's one of the best candy bars I've ever had.
Yes, it is, because cayenne is very high in potassium, and also the capsaicin actually has a tonifying effect on the cardiovascular system.
Now, historically in South America, the Incan royalty were the only ones that were allowed this elixir of life, which was cayenne pepper with chocolate.
Ooh.
Wow.
I know I'd live a very long life with that.
So, I mean, cayenne pepper obviously is one of the, I think, main ingredients in Tabasco, which I love some hot sauce. So there's still benefits even when it's, been fermented in a hot sauce like that?
Absolutely. Absolutely.
It's vinegared.
You know, I do have a question, though. When you were talking about the fresh garlic, would that also include, like, pickled garlic cloves?
Yes, it can. There's a little more preservation of the effect, but the fact remains that the fresh garlic, whether it's taken fresh, it's pretty strong if you've got that kind of constitution, but cooked is still the best way to utilize it. The closer to fresh that you can utilize it, the better the benefits are.
Great.
Now, folks, I take a garlic supplement that's been processed. And the way it was explained to me by my nutritionist is you can't consume enough garlic so that this condensed fermented supplement is actually more effective. What are your thoughts on that?
You know, I'd have to see the actual product itself. There are some products out there that have processes that actually do preserve the allicin aspect and give a lot of the fresh garlic benefit in that form. So, yes, there are products like that out there.
I hear Larry King shilling for it all the time. Larry King for garlic. Let's go to Paducah. Do you eat garlic? That's
the nice thing is
really
they
bad
have
impression.
the research to back their assertions.
Also, I really love reading that nuts, the pecans, the walnuts, pumpkin, and sunflower seeds, those are things I eat routinely. So I guess without knowing and completely unintentionally, I'm helping my heart.
Yes, absolutely. There's a wonderful benefits with fiber as well as your the nut meats. You can use nut oils in helping lower your cholesterol levels and improving your overall heart health.
Now, one thing I'd like to add is water. There was a piece that came out and hit the news last year concerning men. Evidently, women do a little better not drinking as much water as men, but because men, the study that came out stated that if men would increase their water intake by half as much again, they would reduce the incidence of heart attacks by as much as 50%. Wow. Simple. Water. Everybody has access to water. And we're not talking about the water and fluids and soda pops and coffee and things like that. We're talking about water. Increase the intake of water, you decrease the incidence of heart attacks. And why? Because our blood is mostly water.
Right. As we're all toasting here while you're talking. We're all holding up our water bottles. Dr. Bonatti's pounding his right now.
Very good.
Well, Carl, I'm sorry to say, but mine is partly Diet Dr. Pepper, sir.
Oh, not good. Little aspartame.
Loading that goes and stresses your heart.
Hey, while we're talking about heart health, one thing that has been in the news that we've heard that when we're looking at your advanced materials, I didn't see anything on it, but everybody talks about fish oil. What are your thoughts towards consuming fish and Fish oil is a supplement.
You also hear, not to interrupt you, Jeff, but you hear conflicting reports about fish, because then they say that if you eat the fish, there's too much mercury and it's not good for you that way. But I guess the fish oil would be a little different because it's sort of a processed thing. But yeah, what are your thoughts on seafood in general?
GLAs, as found in fish oil, are very, very good. There's two things you have to consider, and they are different subjects, but they tie into purchasing decisions. One is the contaminant issue. The other is what kind of fish does it come from. The other is the extraction method that they utilize and how well preserved. And when I talk about preserving, not using chemicals, but what's the means they use to make sure that the fish oil doesn't rancify once it's in its consumer-ready form. Those are things that have to be considered. For the most part, a GLA-3 is a GLA-3, and so the thing is the quality that is being purchased. But yeah, the research says it helps. The key is that's being challenged right now is how much. We live in a society where if a little bit works, a lot more must be better. Well, there's evidence showing that, like vitamin C, we may not need to take as much GLAs to get the health benefit, the daily, day-to-day health benefit.
Hey, Carl, we're almost, and Joan as well, we're almost out of time, but I want to briefly touch upon some of these herbs that you're talking about. You guys are also experts in herbal medicine. Some of these I've never even heard of: hawthorn berry, butcher's broom, motherwort leaf. What are these things, and why are they good for us, and where can we find them?
Well, nature has provided the most amazing health-building support that if we hook into that ancient knowledge and work with it, we can do wonders for our health. Hawthorn berry, and that's hawthorn grew naturally here in the United States or here in the Americas, and the Indians use it for centuries to support the heart health and blood sugar balance. It helps support the liver, too, but primarily it builds the heart.
Now, this information is all on our website, cedarbear.com. That's CEDARBEAR.com. They go to, and when they bring the herb up, there's a little bit of a spiel about the herb and what you're used for and what it does.
Okay, well, very cool. We appreciate you guys joining us this afternoon on American Medicine Today. Carl and Joan Robinson, some health educators. Again, cedarbear.com for more information. Thanks for joining us, guys.
Thank you.
Thank you very much.
Take care.
Have a great weekend. So very good stuff there. Some interesting.
It is.
I guess it pays to have an Italian wife, too, because like I said,
oregano?
There's garlic on there, oregano leaf, rosemary.
Yes. Hey, and for those, cinnamon.
Yeah.
From now
love
on,
cinnamon.
Onions and garlic.
That's it. That's all I'm going to eat.
Uh-oh.
You guys are good.
Onion, garlic, and bread, and oil.
And then you're going to have to perform surgeries robotically. I think if that are the case.
Nobody's going to want to get anywhere near Dr. Bonatti.
That's why I'll use a mask.
There you go.
All right. You can take some of these if you add a little bit of a toe of a toad. I think you also have a magic potion, too.
Oh, wait. And breath mints after.
Some certs.
Yes.
Yeah, some Tic Tacs, maybe. Banaka. So we're gonna wind up Dr. Bonatti for the next segment, correct? And do what's new in medicine today. Do you got a topic, Dr. Bonatti? He likes to freestyle sometimes too, so we'll get him going with that next. If people want to get in touch with the Bonatti Spine Institute, Kimberly, how do they do so?
Well, they can come visit us in Hudson at the corner of US 19 and Hudson Avenue. Beautiful 11-acre facility, here to help. If you or someone you know is suffering from head, neck, back, or leg pain, give us a call at the Institute, 855-267-0482, or visit the website at Bonatti.com. On the flip side of the break, we will hear world-renowned orthopedic surgeon go off on what he deems up to date in American medicine today on News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
The Bonatti Spine Institute is proud to announce more than a 90% success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit our website at Bonatti.com.
All my pain is gone. Gone. Gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful.
I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati. You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Bermel.
You are continuing to listen to American Medicine Today on News Radio 970 WFLA. Well, I'm here with world-renowned orthopedic surgeon Dr. Alfred Bonati of the Bonati Spine Institute, Ethan Euchre, and Jeff Wagstaff, our co-host of American Medicine Today. And, well, it's that time to sharpen sticks and start prodding. Dr. Bonati, what's new?
Let's look at what's new in medicine today, featuring Alfred Bonati, MD.
A little premature on that, sorry, guys.
Nope.
Dr. Bonati,
all you.
Well, let me ask you something. What do you guys feel about the FCC newsroom regulations?
Well, as a person who works in a newsroom, 6 days a week, what I want to know is the truth, really. What is the spin and the hyperbole and the hype? Because you hear both sides. You hear it being downplayed that, it's just conservatives overblowing it. And then, of course, the station, our flagship station, is a conservative station. So they're sounding the alarm that the Obama administration's trying to get the FCC way more involved in taking away the freedom of press.
Well, do you know that in the last 3 years, we lost the position that we have in freedom of press in the world? The freedom of press in the world was, we were number one. That's our constitutions that we defend that point. Mm-hmm. Well, today, we're number 54.
Wow.
And there are only 160 countries that participate in that. Mm-hmm. So now, this is not a joke. You cannot be thinking, maybe. No, Obama is doing damage to this country all over. Mm-hmm. The damage is going to take us at least 20 years of a tremendous amount of effort for the conservative group
to unravel,
to correct the garbage.
Mm-hmm. Wow.
Let's look now in medicine. One of the things what's the state of the Obamacare today? Was a joke. Mm-hmm. The people who is getting on the Obamacare is the takers again. Mm-hmm. When we talk about the left and the right, God, we really describe it right. Because the left in our hands and in our and our behavior is always the weak part. And the right is always the strong part. Well, in politics seems to be that's the same thing, but in the society seems to be that the left side are the weak, the drug addicts, the takers, the individuals that they want freedom without responsibility. They want to obtain the product of the people who works and get pay for something that they don't do. So it's a horrendous bad representation. Is the dark part of the nation. This needs to be thought a little deeper. We need to start to see. I'm not saying that all the Democrats are bad, but I'm saying they are stupid, the ones that they remain in that position. Because look, 90% of the foreigners, we came to this country with a very clear concept: is we want to be better. We want to be better, but we want to be better by ourselves. We want to have the strength of the control of our lives. We want to have our minds to produce the best that we can give. And we want the strength of our bodies to be able to perform so we can be that shining star that is in our mind. But when you go and you come over dying to have the green card, but when they give you the green card, the first thing you go is run to a situation where you're going to be supported. Stay in your country. That's what you're trying to escape for. All right. The next thing is, what is this joke that you come to the United States and the first thing that you do is you live in ghettos, and 20, 30 years after, these people, they don't still speak the language, and those ghettos are damaging to the production of kids that they are going to be integrated to society. So they become again individuals that they cannot progress. So those things are things that we need to start to think in a right spectrum. We don't need to continue thinking in a wrong spectrum. Now, left side is very sad. It's sad in everything. They don't respect religion. They don't respect the females. They talk about females. Females for them are sex. They're only related with sex problems. They don't talk about the brilliancy of a female, the productivity they can bring, the enormous amount of power that they have in the family. All these things are being ignored. But yes, abortions are great. Okay, so these things are so negative, so incredible in the wrong side, and they still have the guts to defend it. So every politician who belongs to the left side is lying to you.
Now, Dr. Bonatti, not to cut you off, but I saw Joe Biden on the air talking about Obamacare, and you know the term lipstick on a pig. Well, it still doesn't make it beautiful. The problem with Obamacare, we all know. It's the Unaffordable Health Care Act, and he was saying that they were trying to target 7 million people. They were hopeful that maybe they could reach 5 or 6, but these are the takers. Who's paying into this?
Exactly. And the results are, when we have this machine moving in that direction, to undo it is going to be a lot of pain. Look, they promise that we are going to have a better, cheaper healthcare, okay? Now, we know that was a lie, but at the same time, we lost, with the action of these people, we lost 20 million people that they lost insurance. And then what's going to happen there? And what is the responsibility? Well, that's a question, and somebody needs to answer.
And that's a look at what's new in medicine today with Alfred Bonatti, MD.
We'll touch more on that next week, but we did want to preface that we have a TV show, American Medicine Today TV show, and it airs at 7 p.m. on WFTS ABC 28. And we're hoping Ethan's going to be joining us soon.
I was
But
going to say, you guys have a TV show. I'm not involved. But
he is.
No, I'm there in spirit. It's just,
Yes.
I got a lot of things to do. Not that you guys don't. Dr. Bonatti's the most busy guy I know, and he makes time. So I have no excuse.
I don't know if I should throw this out, but there's a rumor going around the FLA hallways as to why Ethan isn't joining us.
Why?
Is it because you can put a mirror in front of him and there's no reflection?
Yeah, somebody says that he doesn't photograph.
Oh, I want to bite your neck.
Well,
no, sorry. That was a bad
That was pretty
vampire
bad.
impression.
But anybody that's watching the stream right now can tell that I can be photographed. So that just douses your theory right there, Jeff.
Uh-oh. And we're going to be taking garlic, so we'll know fairly quickly if
I
that
eat a ton of
happens
garlic.
at all.
All right, that does it for us, you guys.
Thank you for joining us on American Medicine Today. I'm Kimberly Bermel. You can visit the Bonatti Spine Institute. If you actively want to participate in life, visit Bonatti.com or give them a call at 855-267-0482. We'll see you next week, noon to 1 on News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail. The Bonatti Spine Institute is proud to announce more than a 90% success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit our website at Bonatti.com.